So we'll be talking about dry eye, and dry eye disease is a condition when your tears do not provide enough lubrication for your eyes. And our doctor right here will demystify that for us. She's an optometrist. Good to have you once again.
Thank you so much for having me.
All right, let's start with the subject matter now. Dry eye, what does that mean?
So dry eye is a very interesting condition, and I call it interesting because it has a lot of shenanigans surrounding it. Yes, so pretty much it is a condition, like you rightly said, where the tears produced by the eyes are not sufficient or do not provide enough lubrication for the eye, and that causes a lot of irritation. Some patients have itching, there's a lot of burning sensation, there's some have redness. For some people, they just have discomfort. Interestingly, both young and old can have dry eye.
All right, so what are the causes, if I may ask?
Now, like I said earlier, it's interesting because it has a lot of shenanigans. You can't exactly pinpoint one cause, but there are a lot of conditions that may lead to dry eye.
Okay.
For example, we can have people who take certain drugs can have dry eye as a result, as a secondary condition or as a side effect to the drugs that they take. For example, people who take glaucoma drugs, which is an eye condition, can have dry eye. People who take some hypertensive medication can have dry eye as a side effect. Now, dry eye also affects women a lot. People who take contraceptives, contraceptive pills, women who are in menopause, and some women who are pregnant. So you can say for those category of people that the cause of their dry eye is because of the change in hormones. There are also people who can get dry eye because they wear contact lenses. So we wear contact lenses, they look beautiful, but if not properly managed, sometimes you could have dry eye. Sometimes dry eye could be just because tears are evaporating from the eye. That's a condition. So whatever the cause of the dry eye is, that will determine how the management will be. So sometimes the dry eye could be as a result of allergy, as a result of autoimmune diseases like arthritis. Dry eye can also be as a result of weather conditions. So people who are in areas that the weather is humid, people who expose themselves to air conditioning, excessive air conditioning, can trigger dry eye.
You know, since you're women, I was concerned where you talked about contraceptives and then you talked about menopause. It seems there are so many things working against that gender.
Oh, well, I wouldn't say that it is working against us, but really it is what it is. And it is good for women to know these things so that when they begin to experience them, they can seek medical attention appropriately and
understand why
they're having the thing is that many women do not know. So I've seen a lot of women who, by the time you demystify it and you tell them this is what it is, like, what? I didn't even know that it is because I am on a certain contraceptive pill, but they can't stop that. So what we need to do is to manage appropriately and accordingly.
I was going to ask you about risk factors, but it would seem to me that you already somehow mentioned some of the persons who are at risk, or is there something else you want to say on that?
For people who are at risk, yeah, like I said, old age. So now when you talk of old age, we're now not limiting that to women alone. Both male and female who are above the age of 50 can have dry eye because the tear film production or tear production is reduced in old age. So like we've said, women who are having change in hormones, pregnancy, taking contraceptive pills, and who have reached the age of menopause. Risk factors, I also mentioned the hypertensives. And so for those people, there's really little they can do about it because they have to manage the hypertension that they have. People who spend a lot of time on their digital devices.
Okay.
And then don't take time out to rest their eyes. Yeah, so they are at risk. And then not cleaning your makeup properly.
Okay, so what's the proper way to clean it?
Okay, let's even go to how to apply it.
Okay.
Wearing makeup on the lower margin, both the lower and the upper margin of the eyelids, such that the makeup is it just stays in between the lid and the cornea, comes in contact with the cornea. We sometimes advise, or we usually advise, that makeup artists don't apply makeup that way, because the debris from the makeup clog the tear film or the tear ducts, and if it is not properly cleaned, the accumulates and then begin to block the layers of the tear film. So that is a huge problem. In fact, most of the women who have dry eye can be attributed to that. So when we talk about that, you now find that if someone doesn't clean up their makeup properly, probably is hypertensive, maybe is wearing takes contraceptive pills, wears contact lenses, the person has put himself, like, there are lots of one person but with lots of
many things.
Yes. So now you begin to isolate to say, let's find out what exactly it is that will be aggravating. Yes. So by the time we try to eliminate, we can help the person find
what exactly it is.
Yes. And then sometimes it could be a multiple
That's
factors.
very possible. That's more possible.
Yeah. So that's what it is. We advise ladies, as much as possible, clean off your makeup properly. There are makeup wipes that you can use, and then sometimes some people have some other products that you can use. There are products that you can use to wipe your lids properly that are sold in eye clinics and
the normal wipes okay, or do we need to get specific
No, there are
ones?
actually makeup removing wipes that you can buy from pharmacy stores, or you can ask your eye care professional for them. And there are wipes that are made for the eye. There are lid scrubs that are made to scrub the lower lid and the upper lid, and then just to keep it healthy and then help to reduce.
This is a very important information for the ladies, the mothers, all of us.
Yeah, it is.
All right, you talked about devices. So what would be the way to go about that to ensure that we have to work, and in this digital age, we need to use these devices? So what should we do?
Okay, so the best thing to do is, while working on your device, to take a break.
Okay.
We have what we call the 20-20-20 rule. It might not produce a lot of result, but it does help. So what the 20-20-20 rule basically is that after 20 minutes of staring at your device, remove your face, look at a distance of 20 feet away from you.
How do I measure 20 feet?
20 feet is the equivalent of 20 feet.
Okay.
20 feet.
Okay, I get that.
Yeah, so well, people's feet are not the same, but but 20 feet is like 20 feet, So but the basic thing is to stay at a distance for 20 seconds. So walk for 20 minutes, take your face away, stay at a distance of about 20 feet, and then for 20 seconds. Doing that will help to calm the eyes. Alternatively, what I advise people to do is to blink. Okay. Now, when you stare at your device, the tendency for you to reduce your blink rate is very high. So I advise people, blink deliberately. When you blink, you produce tears.
Okay.
Yeah, you force the tears to come up. Now, note that if this person already is taking any of those things or has any of those conditions that we mentioned before, there will be a problem. So it might not produce enough tears to give you comfort while you blink, but it's helpful. People say at all.
Ain't bad.
Yeah.
All right. Very quickly, there's this. I think it's called blue light glasses or something.
Okay.
Do you advise them? Are they okay? Do they work?
Oh yes, they do. I have one.
Okay.
So yes, what they do is to help to reduce the amount of blue light that we take in as we work with our devices, because our devices are really smart. And as the years go by and technology gets better, they get smarter. So these blue lights are incorporated in the devices. So the blue light filter pretty much helps to filter the amount of blue lights that you take in, because taking in lots of blue lights is not very healthy for the eye. What the blue light does is that it aggravates dry eye. So for someone who already has dry eye, it just aggravates the condition. The blue light itself has so many other disadvantages that are not related to dry eye, you know, but are disadvantageous to the individual. And that will be like going out of the topic, because now it reduces the amount of sleep or your quality of sleep you get, because it interferes with the hormone that helps you to sleep, that is called melatonin, right? But that's different from dry eye. So in as much as it helps our devices, there's a lot of disadvantage to us. So we advise that people get lenses that have the blue light filter to help reduce the effect of the blue light on their eyes.
All right, that's very interesting. So very quickly, we've already started talking about prevention, so let's just continue.
Okay, so can dry eye exactly be prevented? For me, I would say it's a yes and it's a no.
Okay.
And the reason why is, if you remember, we had talked about certain predisposing factors, like people who are people who are hypertensive, people who stay in humid environment, people who find themselves in places where there's winter. There's nothing you can do about those weather conditions, but what you can do is to help protect yourself, and that's where we get all the cleaning of your makeup and all the other things that you can do. So prevention, there's really no preventive measure, but you can take steps to help yourself. For example, eating foods that are rich in omega-3 fatty acids, because the tear film is made up of 3 layers. You have the fatty layer, the aqueous layer, and the mucous layer. So if you take foods that are rich, or supplements that are rich in omega-3 fatty acids, you can help to boost that layer of the tear film. So pretty much eating well, and then taking steps, and then seeing your doctor. That is one practice that is not very common in Nigeria. Like, people just walk in and say, I want to do a comprehensive eye exam, and all of this is done based on your age and then your occupation and the things that you're exposed to. You know, there are tests that will be taken out, or the diagnostic examinations that will be taken out, that will be conducted rather. So if you see your doctor today, for example, and he runs all the tests, you can be given an appointment for 6 months or 1 year and all of that. But people don't keep to appointments. People don't even visit their doctor. So it makes it difficult to even
Prevent?
To
nip in the bud?
Yes, when it starts in, because the truth of the matter is that the discomfort that comes with dry eye is not something you want to have continuously. There are people who constantly have, now everybody works with a computer. If you already have dry eye and you're staring at your computer, in 30 minutes you're going to have to stop work, you know, take a break, walk around or do something. But we wait until it gets really bad before we begin to seek attention. And sometimes when it gets to that point, the results, a lot more difficult to manage. That's the word.
Right, so what are the complications, likely complications really?
Okay, so, well, dry eye, the complications are not very much, but they can be as bad as your life is disrupted, in the sense that if I cannot drive at night comfortably, or I can't work on my computer for 2 hours at a stretch, my life is disrupted, right? So sometimes, when in very severe cases, people can have what we call corneal abrasions or corneal ulcers, and if that is not also properly managed or identified on time, the person can lose a significant part of their vision. So yeah, the complications can look like they're simple, but can also be very complex.
All right, so let's talk about treatment and basically management.
Okay, yes. So treatment means that you're going to have a cure. I would rather we use the word management. Okay. Management is eating well, like I said, foods and supplements that are rich in omega-3 prescribed. Visiting your doctor to give you what we call artificial tears. There are tears, yes, the tears, there are artificial tears that lubricate the eyes, staying away from the vent of your air conditioning system or hair dryers, you know, just not putting them directly on your face or over your face. So you can, if you're driving, you can shift the vent of the air conditioning system in your car. Yeah, you get, or in your house, you don't sleep facing the vent of your air conditioning system. Another thing you can do is, for people who are taking drugs, just let your eye doctor know so that they can co-manage you appropriately. Yeah, and then I can't say this enough, ladies, clean your makeup every night and clean it properly. That is, we will reduce the number of dry eye cases that we'll see significantly if we can get these right.
Is that to say that more women have that condition?
Yes, more women have dry eye than men do. Yeah, more women have it.
All right, I think this is a good place to end the conversation, but we won't let her go without, hearing one or two tips, some thoughts from you basically to our audience.
Okay, so pretty much all I will say is eat well and book an appointment with your doctor to have a comprehensive eye exam annually. And this is not just for adults, both adults and children. Parents usually don't think that their children require eye exams until things get really bad. So please see your doctor and stay well.
Thank you so much for coming on the show.
Thank you so much. I'm really glad to be here. Thank you.
All right. Well, we've been speaking with Dr. Ola Bukola Olalere, and she has told us a whole lot about dry eye. I hope you'll adhere to the things that she has talked about. Many thanks for watching. Do enjoy the rest of the day. I am Perpetua Fasami Peter. Bye for now.